but I'm going to do my best. All right, let's start with our first um, series of talks. This is called The Heat is On because it's the heat that's really driving the whole system. We would not have hurricanes, we would not have excessive precipitation, we wouldn't have a lot of the issues we had if it wasn't for the change in the heating that we're getting. So the title of the first one is The Heat is On, and it's really driving our hurricanes and storm surges, our extreme precipitation, and really our droughts as well. And these extreme events are happening one after another, and sort of one thing and then the other, then one thing and then the other. It's just amazing what's going on. Sea level rise are harmful algae blooms, which, by the way, we have a big one coming onto the coast right now. And of course, today's topic, climate and human health. And we have one more in our big five, and that's biodiversity, and that'll be next year. So that'll be the topic of our 5th Florida Climate Conference next year. So I want to show you this. We worked on this graph for 2 years, trying to figure out how to tell the story in one picture. And so the ice age was 24,000 years ago, the last ice age that we had. And the one that David talked about during the Roman Empire is hardly even a little bump on here compared to the scale of this graphic. So 24,000 years ago is when we started coming out of the last ice age. And you'll see that it took 12,000 years for it to get up to the bottom of that green zone. And that's about a warming of 3 degrees. It took 12,000 years. So remember that number. At that time, there were only 5 million people on the earth, 5 million. Then the climate went through this long period, as far as we're concerned, of stability where it didn't vary more than a degree. And that stayed until 1950. During that time, our population went from 5 million to 5 billion. And because we had this incredible climate stability, but in 1950, it went out of the green zone, through the yellow zone, and into the orange zone, and we're heading for the red zone. The amount of temperature rise that we had in 12,000 years, we just had in 170. So when people say, well, the climate always changes, I don't even like the word climate change. I'm not the only one, I guess. But I like the word climate warming because it's getting hot. And at the rate we're going now, we're putting ourselves in incredible danger. And what you're seeing outside your window these days is weather that has changed because the climate has already changed. So it's going to continue to change, and that means that our only real solution for the next lifetime is adaptation. And that's why we have the Climate Adaptation Center. That's why I wanted to do this. Because our focus, well, it needs to be net zero and stopping climate warming, coal. It's going to take a lifetime to do that, even if we do really, really well. And in the meantime, we have to get over the bridge to a future stable climate because we're not in one right now. So these are the temperature records. If you look at back to the beginning of the Industrial Revolution, and you can see how at the beginning it was cool and then it started taking off, and it's a ramp, folks. It's growing very fast. And 2023 was the warmest year in human history. We know this from the ice cores and the tree rings and the sediments. In the human experience, we've never had a temperature like we had in 2023. And we have about 6 weeks to go. There's a 95% chance now. So Time to bring your umbrella, Elizabeth. Your two umbrellas. There's a 95% chance that it will be the warmest year in human history. And they're coming one after another. We've had 50 more extreme global heat days around the globe this year than we had in 2000. The last 12 months are 3 degrees Fahrenheit warmer than the baseline during the Industrial Revolution. So we definitely, the heat is on, and that's what's driving things. It's the climate impacts. We know that the chances that this is a natural progression of climate is only 5%. It's a 20-to-1 bet that this is human-induced. Give me that bet every day. I'll make that bet every day and win 19 out of 20 times. That's a pretty good bet. So last year, 500 billion hours of labor around the world was lost due to heat, excessive heat. So that's getting to be a big economic number too. And zooming in, right here in our neighborhood, you know, the last few years, we've had some amazing hurricanes. Hurricane Ian in 2022 did $113 billion of damage and drowned a lot of people, most of them right here in Florida. We had an 18-foot storm surge. That's salt water. And then Hurricane Idalia, we had 4 to 5 feet of storm surge with a storm that was 150 miles off the coast, never came inland. These storms in the past did no flooding, did nothing. And yet we had a record storm surge from a storm that was a hurricane, but it wasn't here. And it was to then the worst flooding we had seen here. And then last December, out of the clear blue sky came a cold front. Wasn't a tropical storm. And we had a storm surge and surprise flooding again. And then this year, we've had the trifecta, Debbie on the 5th of August with freshwater flooding, Helene on the 26th with storm surge and flooding, and on October 9th, Milton made us ask, is paradise lost? I don't know, remember that book? Anyway, on freshwater issues, we saw a 500-year inland flood in 2022 from Hurricane Ian, 24 inches of rain. We don't get rain like that. Our storm system for removing water is not sized to 24 inches, but yet we had 20 inches this year. So in a couple of years, we've had 2 20-inch plus storms, and the design of our infrastructure is not up to the climate we are now having. We had an unnamed tropical storm on the 11th of June that created a record amount of rain in downtown Sarasota in the history of observations and flooded downtown. Had it been off the coast for 5 more hours, it would have been our first named tropical storm. And we had tropical storm force winds at the airport. But a record rainfall, 10 inches, and 6 inches or so fell in just 1 hour. Can you imagine that? And Debbie was a 100-year flood inland. The whole purpose of this is to show you 500-year floods, 1,000-year floods, 500-year floods, all happening in the space of 2 years. So they're no longer 100-year floods, 500-year floods, 1,000-year floods. What it is what we have now. This is our life. So you saw what Helene did up in Asheville that shocked the world, right? So, I mean, we had a lot of rain here too, but Helene had 50% more rain, according to our attribution science, because warm air can hold more water. So our run-of-the-mill storms now hold 50% more water than they used to, and that's why we're having this excessive precipitation. So, this is what it looks like. This was the bridge to Sanibel after Ian. This is the rainfall map after Ian in that blue area, which goes through Sarasota County, was 24 inches of rain. This is St. Armand Circle after Helene. These pictures aren't really widely shown enough, in my opinion. But the question is, this was the 5th time this year St. Armand Circle has flooded. 5 times in 1 year. If you went back 25 years before this year, not 5 times. So the rapidity of what we're getting is different now. And the question is do we want to keep rebuilding and facing the same result, or do we want to do something different? That's the question we need to answer. Just because we do it some way now does not mean that we have to do it the same way in the future, especially given the information we now have. Now, many of you love Marina Jacks and the Bayfront Park, and this is a picture this summer during one of the storms where our beautiful dolphin base, the statues there, where the dolphins went swimming for the first time since they were put in. And of course, this is the shore downtown in St. Armand Circle. And this is, a scene from June 11th at rush hour. And it's amazing. People drive their cars into this, and I'm thinking to myself, oh my God, what are you doing? On June 11th, we had that storm, unnamed, and you can see that the big impacts are right here in Sarasota. For some reason, we have a bullseye on this, and this is why I call it ground zero for climate warming. Here's another example in Sarasota County, the Laurel Meadows subdivision. Beautiful homes surrounded by water, lots of solar panels. And this is the flooding from Debbie. This is a radar display where we've added up all the rainfall totals, and that area right in there is over 15 inches. But it happens to be over a heavily populated area. So when you look at this, you can see all of the events that are happening and all of these events and when they've occurred, and you can see that most of them are since 2000. These are all of our record events, and we don't have very many record events left that were in the 20th century. They're all in this century. So here's the problem. 95-degree days are going from 10 a year in 2010 to 70 in 2050. 10 to 70. This is a health issue for Sarasota. It's not only going to drive more storms in the future, but it's going to drive increasing sea level rise. We're expecting another 9 inches of sea level rise by 2050. We've had roughly a foot of sea level rise. So we're talking by 2050, in 100 years of time, almost 2 feet of sea level rise in an area where lots of places are 5 feet. Stephanie's house is 4 point something. Most of Longboat Key, all of St. Armand Circle, Minnesota Key, all of the keys. And we're losing these buffers that we had because the sea level is rising and it's almost imperceptible until a storm comes. So major hurricanes average 3 a year, and in our forecast, we said by 2050, it would average 6 a year. Well, we're almost there this year, right? We're at 5, and maybe by next week, we might be 6. So we're hoping not, but it's possible. So this is in Tampa. This is a heat index of 103. In the 1970s, it averaged 10. And in the 2020s, so far, it's already up to 45. It's getting hot quick. This is amazing. Our risky heat days of heat and humidity now have gone up to 54 days since 1970, 540% increase. Warmer summers, 6 degrees warmer than 1970. The average low temperature at night in Sarasota. You wonder why it feels so hot at night, you know? Because it is, right? And so this is a really interesting chart. I know it looks complicated, but it's the temperature of the air versus the humidity. The temperature is on the left column. The humidity is across the top. And you find your temperature and your humidity, and you find the heat index, okay? So when it gets into the red boxes, it's dangerous, okay? And you'll see the red boxes on the right, on the bottom right. There's no numbers in there. And that's because human beings can't survive in that temperature. So there's no numbers. So if the Earth turns out to be in that red zone, we won't be around to measure those temperatures. But we're approaching those temperatures, and I want to show you. Whoop, what did I do? So 106 to 129, you see that white circle? That white circle is where we are right now. And by 2050, we'll be in the green circle. So we're getting to the edge of what we can really do in a lot of these places. So we have to really make sure that our urban development takes this into account and we build cool cities, not hot ones. And so when we build 18-story buildings downtown, because that's the way it was zoned in 2006, and they're one right next to another, we create this heat island effect. And we don't get the sea breeze. Thank God we have that. It's a real asset for this community. But if we block it from coming in downtown, we're going to create, in addition to climate warming, a 5 to 10 degree boost in the heat on a summer afternoon downtown. We don't need to make that choice. We can do something different, and we can still have sustainable development. But if we do that, it won't be sustainable. If we want people to live here all year around, we can't do that. And that's a choice. It doesn't have to be that way. So if we combine the hot summer days and nights, you know, they've gone almost triple. And that's because we get these heat domes. You've heard about this. We get these large high pressure areas, and the heat and the air sinks in the center of these high pressure areas and not moving as fast as they used to, and so it locks the heat in over our areas for longer. So we're seeing longer heat waves. So all of this is having health impacts: heat, disease, air quality, mental health, and part of the mental health issue is migration. And Stephanie told you a little bit about their story. It's a migration story. What do they do? It's not just putting their house back together, but where do they want it to be? Knowing what they know now, what will they decide? And there are hundreds, if not thousands of people right now who are making these decisions. And that's the reason we're having this conference. Because informing these decisions now will help us all make better decisions every single day. It's not about the future, it's about today. It's not about somebody else's life, it's about your own. So heat stress is a big deal, and we'll be talking about this throughout the conference, but You know, the human body can only take so much. And we have CAC members here that were on the edge of heat stroke this summer and had heat effects. And I have emails, and one of them is here, but I'm not going to tell you who she is, but she told me. Believe it or not, heat is the deadliest weather phenomena in the United States. It's not floods, it's not hurricanes. It's hard to believe, but it's heat. And one of our issues with heat is we don't know how to measure heat deaths, okay? Heat deaths occur on death certificates a year later, and then we compile them. So when we have a heat wave, we have no real-time monitoring system to know for sure how many people are having heat stroke, how many people died, how many are having cardiovascular events, how many people are there on certain drugs that are exacerbated by heat that creates medical issues for them. But since this is the largest climate cause of death, shouldn't we have a real-time monitoring system in our medical community that keeps track of this, just like we do hurricanes? We know every minute when a hurricane is coming. There are planes flying it in, reports coming out, all the news media is covering it. But yet when we have a heat wave and thousands of people die, we really don't know until later that that really happened. So here's an example of underreported impacts on heat-related illnesses. One of the things I don't lose sleep over much. You know, I'm a climate scientist. I've been through this for a long time. I've thought about the worst case scenarios, okay? So I sleep pretty good. But this is one that keeps me up at night when there's a hurricane during the summer coming on shore in Sarasota where we know we're going to lose power for a week or two and could be followed by 95-degree days every day with no air conditioning, with no way to leave, 24 million people. We are on the edge of having a catastrophe from heat, and people don't realize it. So adaptation now is going to save a lot of pain and suffering and catastrophe in the future. It's just a matter of time. We've had some hints of this in Texas when Hurricane Beryl went in and they lost their power, and hundreds of people died in a few days there. So we need a more sophisticated health system, one with real-time capabilities, a medical infrastructure with multiple locations for treatments. For example, let's say we do have a heat emergency. We're building schools like nobody's business on the west coast of Florida. Couldn't they be heat trauma centers too? Couldn't they have independent power so they don't lose air conditioning? Couldn't they have parking lots for people to park their cars that live on the Keys when a hurricane hits so they don't flood? How many people in this room lost cars, right? Put your hand up. So cars were lost in these hurricanes because they had nowhere to bring them. If our schools were mobilized as emergency centers for climate issues, which happen mostly in the summertime when the kids aren't in school, we're spending all that money on these schools. Why don't we rearrange the pieces of the puzzle that are on the table and do it differently? Steve Jobs did that with the iPhone, and now we can't live without it. He didn't invent the calendar. He didn't invent email. He didn't invent the telephone. He didn't invent Google Earth. He didn't invent maps or calendars or notes. He just put them all in one place. And then now Apple is the most successful company in the history of the planet. And we have that option every day, and we don't take it. It's the inertia of our previous decisions that's really separating us from success here. And with all of you in the room who are leaders and thought leaders, it's really not up to anybody else to make these decisions. It's up to us. It's not our politicians. I mean, you elect them, right? So, I mean, but they know less than you know. Right now, I can tell you, already you know more than they know. So, we're filling the adaptation gap, and you can see in this chart all the science papers that have been written on climate and extreme weather events and mitigation and adaptation. You see those little green things? That's adaptation. It's growing. But we're going to run out of time before we get that big green bar in there if we don't get going. So adaptation is really very, very important. Okay, so let's rearrange and adapt our healthcare system now and our medical infrastructure in advance of these likely events. This is the important thing, and this is the climate umbrella. We impact the climate, and then the climate impacts us. Thanks very much. Okay, our next talk is, David, you want to just, I can give you. Presentation 2 is Dr. Fu. Now, this is, now, promise you're not going to laugh. Do you all promise? I am sorry to say Dr. Fu has the flu. But he actually came from, he was going to be here today, and he called yesterday, he has COVID. But we were able to get him in his home in Miami area. And when we first got him, he was in his pajamas, and so he was up on the big screen. And then he went and got dressed, and we recorded his presentation, and he'll be with us live on the mic to answer your questions when we get to the question and answers. So Dr. Fu is an associate professor of clinical anesthesiology at the Miller School of Medicine at the University of Miami. He is an engaging guy, and I never really laughed so much as I did yesterday with anybody who had COVID. So anyway, without further ado, Eugene.
Okay. Hi, this is Dr. Eugene Fu. I'm sorry that I can't attend the meeting, but I'm very delighted here to give a presentation on the medical perspective of heat illness. I am currently faculty at the University of Miami, associate professor in the Department of Anesthesiology, and I will be presenting this lecture as we speak. Yeah, I'm sorry I can't be in Sarasota today, but I'm delighted to give this lecture on the medical perspective on increasing heat health issues. For disclosures, I have no potential conflicts of interest. And I want to first just give you an idea of the temperature changes that's been happening in the last 20 years or so. And basically, summer of 2023 was known as a record banner year of high temperatures. And it's showing that 2024 is also approaching that as well. And if you look at this graph, which is from the Goddard Institute of Surface Temperatures, what they did was, instead of analyzing absolute values of temperatures, what they did was they compared temperatures from a baseline period, which was between 1950 and 1980, and then compared how 2023 compares to that. And as you can see that in the summer months, there was an anomaly of greater than 1 in 2023. And as you see in 24, it's even higher than that. So basically, this is giving credence that things are getting hotter every summer. This was from the Miami-Dade website on heat temperature, and this shows you that the heat index is high, and and it is higher in the 2000 from 2011 2020 versus the blue, which represents years before that, in the 1950s to 60s. So you can see that in the Miami, you have increased temperature as well. One thing is that the purpose of this lecture is to give you an idea about heat stroke and the dangers of heat illness. And one point that I'd like to convey to the audience is that everybody in the audience, because they're interested in heat education, heat adaptation, can become an expert by self-educating yourself. And one thing to look at is that when you go on a hot day and you have an event, whether it's a sporting event, a concert, or an event where it's outdoors and there's going to be a lot of people there, always try to see what will be the heat index for the day. And you can be able to look that up through the weather apps. And the calculation of heat index is based on this complicated formulas you see here, where you have coefficients of T and R, which reflects air temperature and relative humidity. And through this complicated mathematical equation, you get the heat index. As you can see here with the color codings from the yellow to the red, you can see the severity of the heat indexes. Now, this can be better displayed on this graph here, which you get from the weather.gov. And as you can see here, this shows you the relationship between temperature and relative humidity. So basically, I recall when my son would play soccer, there would be easy days where you're at 92. And so if you have 60 degrees humidity, you're at this 105 heat index. And so we know that in the summer months, our children can be playing in this kind of weather here. And this is already once you hit the orange, you're in the danger zone. So I want to give a medical perspective of heat illness. And I just wanted to just explain some concepts of classical versus exertional heat exhaustions versus heat stroke, and see and let you know how the medical experts in Miami-Dade try to handle heat exhaustion and heat stroke. And then I'll also want to talk to you about the pathological consequences of heat illness, especially as it relates to Florida. Okay, so who's at risk for classical heat illness? The two obvious groups are the very young and the very old. And so basically with the classical heat illness, you can get heat illness without having to do any exertion. It's just by being in the hot environment, you can get into heat illness. For heat exertional illness, this is the one we think about in terms of athletics, outdoor workers, agricultural workers, construction workers. And so then we have to ask ourselves, how do we prevent the heat illness? And preparation, is important. Like we know that medical equipment emergency plans are done, especially say at big sporting events such as marathon runs. You know that there's medical personnel involved for that to help. But education for the people who participate in the events, so parents, athletes, and coaches should be aware of heat illness. Look at the temperature readings, and then also be prepared for fluids, for the athletes or for whoever's participating in that event. Here's a slide that shows you that there are experts in the medical field that have a really exquisite understanding of how heat illness affects the body systems, whether it's kidney, lung, liver. And basically, they were able to show the difference between classic heat stroke and exertional heat stroke. And as it turns out, in a young person who gets exertional heat stroke, he could have worse, or he or she could have worse rhabdomyolysis, which is muscle breakdown, liver dysfunction, renal failure, and DIC, which is disseminated intravascular coagulation, which is a coagulopathy. So basically, as you can see here, the young person out in the field or out in an athletic event that gets exertional heat illness can get some very severe organ damage that you might not see in an elderly person who gets classical heat stroke. So now, as I told you the difference between classical heat stroke and exertional heat stroke, getting heat illness, now it's common. It can happen to either these kind of events such as heat rash, sunburn, heat cramps, heat exhaustion, heat stroke can happen whether it's classical or exertional. So I just want to now focus in on, say a victim gets a heat illness. The first three, heat rash, sunburn, heat cramps, are more controllable situations. The danger zone happens once you get to heat exhaustion and heat stroke. And so basically, if you look here at this schematic, heat exhaustion is where there's dizziness, heavy thirst, some nausea, weakness. But but you're on a slippery slope, that if you don't properly intervene, you can get confusion, dizziness, and unconsciousness. And so once you're in the heat stroke zone, you're pretty much 911. This is where you got to have medical personnel. But what I'm going to tell you is that if you're even in this stage, you still want to have paramedics involved. And this is what I'm going to show you. I have a collaboration with the Miami-Dade government, and they have a good website that shows the differences between heat exhaustion and heat stroke. And here is the web link as shown above. And I wanted to show you what the people in the Miami-Dade Fire Rescue Medical Operations Manual says. So they have a very elaborate plan of how to handle heat exhaustion versus heat stroke. So as I said before, heat exhaustion, you can get the starting of feeling faint, and then it can start with vital sign changes such as hypertension, tachycardia. And some of those victims might not be able to drink without vomiting. So you got to be careful how you deliver fluids to these victims. And then it can get to the point where even with heat exhaustion, the paramedics would need to put in an intravenous line. So even with heat exhaustion, I would advocate that you would want medical personnel on board, because the slippery slope now comes in is where you don't know when heat exhaustion slides into heat stroke. And so the heat stroke is obviously a 911 situation, and this is when the temperature is reaching above 102 degrees Fahrenheit. So basically here, you're getting mental status changes. Patients can start becoming confused, unconscious, and then they can have total nausea, vomiting, or they can develop into shock. And so basically here, rapid cooling is extremely important. And so in the heat stroke, you do need to establish intravenous access with normal saline. You got to make sure that they don't develop congestive heart failure. There you need to have cardiac rhythms monitored, 12 lead EKG monitored. And then also you got to worry about the development of seizures. And so there's medications such as midazolam which can treat the seizures. When you manage heat stroke, the goal is to try to get the temperature less than 39 degrees, which corresponds to about 102 degrees Fahrenheit. And then the goal is that once you get to the hospital, hopefully, but once you're in the hospital, the temperature can get below 38 degrees, which is like 100.5 degrees. So the goal is get to the patient to the emergency department, give them anticonvulsants, and then for vital sign managements, you want mean arterial pressures of 65 to 75. So here, I just want to show you pictures of how they do active heat cooling. Basically, once the patient's on this bed with the blankets, ice is applied, and then you want to wrap the ice around the patient. So that's the way to do cooling immersion. So then that gets to what are the physiological effects of heat illness? And basically, the cardiovascular effects is something that we have to be very concerned about. And so then you would have to worry about cardiac disease, myocardial infarctions, and also you got to worry about the hemoconcentration and the hyperviscosity of the blood. And so then they're also at increased risk for strokes or clotting to the central nervous system. And then another important organ system that hasn't been discussed as much, but now is becoming more focused, is the kidneys, where you're worried about the effects of chronic kidney disease, or you're imposing acute kidney injury on top of chronic kidney disease. And we think that a lot of the patients in warm climates are getting worsened kidney function in relationship to the climate. However, that's being difficult to prove because there's so many other things that can worsen kidney disease, such as hypertension and diabetes. So it's hard to separate those variables. So I wanted to show you a few studies that came out of Florida about what are the impacts of heat illness in our population. And one of the authors is Christopher Ueho, Dr. Ueho from Florida State University, and he analyzed 67 Florida counties. And basically, he looked into cardiovascular disease, dehydration, renal disease, and respiratory disease. And he found out that higher risks was associated in the Southwest Florida region. He also showed that the counties that had a higher propensity of industries such as farming, fishing, mining, construction, those tend to be more higher risk, as those tend to be more outdoor types of work, where lower risk counties had more industries associated with, say, installation, maintenance, and repairs, which I presume to be more indoor kind of work. An interesting study from, if I can show it, from Dr. Chikas out of Emory, where they did longitudinal renal function assessment in Florida agricultural workers. And what they showed was they assessed renal function acute injury between 2020 and 2022. And they compared nursery workers from Apopka and fernery workers from Pearson, Florida. The nursery workers, interestingly, were doing tasks such as cutting, trimming, packing, unloading trees. But the thing was they worked on an hourly schedule, where the fernery workers, they weren't paid by the hour. They were paid by piecemeal. So it was based on the job. And so they were doing cutting, bundling, and loading fern onto their trucks. Well, what was interesting was that the fern workers, their AKI, or acute kidney injury rate, went up from 21% to 43% between 2020 and 2022, while the nursery workers, their rate started off at 11% and remained stable pretty much during the 2-year period. So why such a difference between the two types of outdoor workers? And the thinking is that the fernery workers, they were working by the job, which means they don't want to take breaks. They wanted to, in order for them to earn their salary, they needed to keep doing extra jobs. So the thinking is that the nursery workers had, say, breaks and ways of pacing themselves, ways of hydrating, where they think that with the fernery workers, because they were so pressured to get the next job, they might not have been as cautious in terms of getting their breaks, getting their hydration, and they were more interested in getting more jobs done. And now in this slide, I just wanted to show you what the Florida tracking does in the Florida Department of Health. And what they did was they showed heat-adjusted emergency department visits during the summer months. And this is based on per 100,000 patients. And it's interesting, and if somebody else in the audience could give me an idea, because I have never lived up in this region of Florida, but, sorry, hold on. Okay. But it's these counties, Calhoun, Franklin, and Gulf, that seems to have the higher incidence of emergency department visits. And where we are down in South Florida, fortunately, we happen to be in the lowest category. But you can see there's variability throughout the state of Florida. But I guess one of the goals will be to see what's happening in this region here, such that we can try to get everybody into what South Florida is having. So basically, as I discussed about heat illness and how it impacts people in the Florida region, I just wanted to just go over what are the future challenges facing us with heat illness. And one is that as the global population ages, climate change will be an important consideration in healthcare policy. And as you can see, age itself is a risk factor for classical heat illness. Number two is that the kidney appears to be center stage for heat-associated morbidity. It's interesting that global climate experts say that in regions such as Mexico, Sri Lanka, India, Egypt, these are hot rural regions of the world, and they don't have the diabetes and hypertension that we have in the United States. And the people in these regions are getting what they call unknown origin of chronic kidney disease. So this could be a possible way of somehow linking climate to kidney disease. So it's just interesting, like how other populations of the world are also getting it based on climate. And then another point is that the frequency and intensity of extreme heat events will increase as global temperature rises, and it becomes important that we develop heat illness-based algorithms of how to, once we see a patient getting heat exhaustion, heat stroke, how do we get that person quickly into our medical emergency activation system? And then finally, I just want to reiterate that the lectures that I give with heat illness have not been with my medical school. I'm a faculty at the University of Miami, and I haven't been able to incorporate a lecture in the primary didactic program where I can teach medical students or residents heat illness. So I think one of the things that should be done is that we need to convince the medical school curriculums that heat education should be a high priority item as part of the core curriculum. Okay, so wanted to show you here. I showed you the slide earlier, and the reason why I want to iterate this is that this is the kind of lecture that I would love to give to medical students and residents. And right now, it doesn't fit into our curriculum model yet. Here are some cards that I want to show you from the American Heart, where they look at stroke. And if you see here, they show you that they want to have, within 10 minutes, assess the patient, within 60 minutes, do a CT scan, and then within 60 to 90 minutes, start thinking about a treatment. And so they have a timing of how to rescue a patient who's having stroke, and then getting them through CT scan, getting them through some kind of treatment, fibrinolytic treatment. And so one of the authors, Dr. Rubley et al. From the Denver University of Colorado system, has one algorithm where they show that in 5 minutes, they want to recognize heat stroke. Within 10 minutes, they want to do rapid cooling. And then in 30 minutes, they want to do continued cooling where they get the temperature below 39 degrees. So basically, this is one form of algorithm which looks pretty detailed of what we could be giving healthcare providers. Right now, there's stuff that's being printed, but right now there's no standardized manual for heat stroke. And so one of the things I wanted to bring to the audience was how could we take the initiative in trying to develop, say, special educational packets that can be given to all the providers and then also to non-clinicians as well, because you got to remember non-clinicians as well get certified in BLS, which is basic life support, or ACLS, which is advanced cardiac life support. So there's ways of getting both clinicians and non-clinicians educated, and we need to get some form of universal standard educational material. And then finally, I want to just go over the collaborations that I have done and the resources that you can look as to how to self-educate on heat illness. I belong to the Florida Clinicians for Climate Action. I meet with the Urban Heat Research Group that tries to do heat research at FIU and University of Miami. And then we do have a report with the Miami-Dade County Chief Heat Officer. And also we were able to get materials from the Miami Fire and Rescue Department. Thank you very much for giving me the opportunity to present this lecture.
You know, on my talk, I had no idea that the air condition was going to fail in the room. So the heat is on. I didn't mean it that way. But I am here to tell you now the fan is fixed, and if you feel the cool air, really sorry about that. But I think Dr. Fu knew he couldn't come here. He didn't want to have heat stroke, so he decided to do it from home. But anyway, you know, here's the thing. I mean, when you think about what he's talking about is he knows what needs to be done. And yet the system doesn't want to change, it's slow. And this is where entrepreneurship is so important. We all have to be entrepreneurs within the institutions that we work for to push for these changes internally. Entrepreneurs inside, because that's where the changes will be made. Again, it's hard because you have to deal with people who don't really understand the front lines that you're on. And so this is a problem that we have, but better communications, we have so many of the answers, they just need to be implemented. It's not like we have to go and invent everything. We don't need to invent everything. We know the answers, we just have to have the courage to go out there and make them happen. So I'm really glad here today to be introducing Ankush Bansal. He's also from the Miami area. He's an internal and lifestyle medicine certified physician. And when he finishes here, he's going to COP29. He's leaving from here to go to COP29. So I really thank him for making time to come in, and another really engaging guy. He has a lot of great things to say, and you'll hear a lot on the public policy side. So Ankush.
Thanks so much, Bob. Can we, son? Great. So Bob, I agree. I don't like the word climate change. In fact, many of us around the world, we actually use the term climate crisis, because that's really what it is. And you had mentioned that I'm going to COP29. It'll be my 4th COP in a row. We've got a very robust health community there at the COP meetings. And what we say is the climate crisis is a health crisis. And last year at COP, I actually had the privilege of hearing a very, very profound quote from David Boyd, who's the United Nations Rapporteur on Environment, Health, and Children. And he said the climate crisis is a human rights crisis. So what I would say is the climate crisis is both a health crisis and a human rights crisis. On education, Karen will enjoy this, but you know, Dr. Fu was talking about how we're not taught about climate change, even to this day in medical schools. There are a few medical schools around the country, Harvard is a prime example, where they do integrate climate change into the curriculum, but it's few and far between, and the only reason it happened is because the students demanded it, including sometimes through collective action. And that's how they got that there. However, the beginning of this year, the University of California, San Diego was the first university in the country to require climate change training of all the undergraduates. It doesn't matter what your degree is, what your major is, you will learn it before you can graduate. It's now a requirement there. It's interesting because a lot of other countries actually do include climate change training in their medical school curriculum. And you'll never guess which country is right now ranked top in the world on integrating climate change in medical education. Any guesses? Nope. Nope. It's, I'll give you a hint, it's in the African continent. It's Rwanda. Rwanda, and they only have one medical school in the country. And they have the most robust climate change education. So as Bob mentioned, I am a physician. You can see my titles up there. I actually live in West Palm Beach. In 2008, no, 18. think it was 18, we got hit by Hurricane Irma. It actually damaged a significant portion of my roof such that the whole roof had to get repaired, and it took over 2 years of litigation with the insurance company and then the roofer to finally get it fixed. Hurricane Milton, which you all felt the brunt of, on the East Coast, we got hit by tornadoes. My neighborhood was actually flanked by tornadoes on both sides. And if you recall, there was an EF3 tornado that hit a new community in Palm Beach Gardens. It just so happened that that was the community that was right across from where I used to live 2 years ago. And one of the houses there that was damaged, the owners had moved in to this brand new house just 6 weeks prior. And now their house is damaged. And I think that's the one where you see the pictures of the dumpster on the roof. So this kind of thing, unfortunately, is happening more frequently. So what I'm going to talk about is, in the face of climate change, particularly heat and extreme storms in Florida, what can cities, counties, and communities do to mitigate the effects of excess heat and adopt preemptive planning in the communities? So you heard from Dr. Fu about the medical part. I'm going to talk more about what can be done from outside the hospital and outside the clinic. So why does this matter? Climate change affects health by 4 broad ways. You see it on the left-hand figure. There's direct impact, spread of disease, disrupting the food supply, and disrupting well-being. Florida Clinicians for Climate Action, which I helped co-found, and Dr. Fu is also a member of, we developed this acronym called HEATWAVE, which is very apropos for Florida, to summarize the specific heat health effects. I'm only going to be talking about heat illness, not the other ones, but just keep in mind that all of these health effects are interrelated, and I'll give you an example of a very recent example in this area later in the talk. Again, why does it matter? This is another visualization of the health effects from climate change. I'll focus on the area around 10 o'clock on this chart, which is the heat effects. So I'm just going to go briefly on heat stroke because Dr. Fu did a great job. There's 2 things that I want to add on. Number 1, when you get to heat stroke, you do not sweat anymore. Your body has given up. It cannot sweat. You will sweat with heat cramps and heat exhaustion. You will not sweat with heat stroke. And that's when the body temperature rises around 104 degrees. That's when you stop sweating. And that is an emergency, as Dr. Fu mentioned. So I'm going to talk about 7 strategies that can be used at the governmental or community level. And the reason I picked these 7 strategies is this is what I found in the literature, both in the scientific literature and the policy literature. And the other important piece of this is these target particularly vulnerable populations. So that's the young, the elderly, disabled, those working outside because that's their only means of income, as well as those, and I'll mention this again, those in prisons, detention centers, and jails. So the first is heat health warning systems. So let me back up. Dr. Fu mentioned the heat index. So there are 2 ways to measure the effects of heat on your body. The heat index is what we see all the time. That's what you see when you watch the news or go on your weather app. The problem with the heat index is that's what your body feels in the shade. So it's affected by humidity, and that's why the heat index is higher than the temperature. But that's what you feel in the shade. Most athletes and most people working outside are not working in the shade. They're working in the sun. So it is much, much hotter. That's a more complicated formula than what Dr. Fu showed you for heat index, but this is called the wet bulb globe temperature. And this is what the body feels in the sun. So it takes into account not just humidity and the temperature, which is what the heat index does, but also the intensity of the sunlight and the wind speeds. So now, moving on to heat health warning systems. What are they? So a heat early warning system uses weather and climate forecasts to help people prepare for and reduce the health effects of extreme heat. There's some government tools that I'm going to show you at the very end, and I think you get a copy of the slides that you can use, and those are great. The problem with those tools is that they're at the national level and they go down somewhat to the community level, but we don't have tools that go down to like the street level or the neighborhood level. And that's one of the things that we need more research on. So a good research, and I think Dr. Fu had mentioned this, is heat.gov. There's a lot of resources on there. But the heat early warning system then leads to a heat health action plan that includes the warning systems for both policies and strategies to reduce the health effects of extreme heat at any governmental level. So that's local, that's your HOA, that's the county, the state, the city, as well as nationally. Miami-Dade, for example, has an extreme heat action plan, and that was developed by the chief heat officer of Miami-Dade, which, by the way, was the first chief heat officer of any city in the entire world. So Miami-Dade was the first on that. And we can establish these early warning systems to predict heat waves and issue public alerts, especially for those most at risk. But we also need public education campaigns, especially for vulnerable populations, on what the signs of heat illness are and how to respond. So that requires partnerships of all these governments, but you also need efficient, streamlined, and robust assistance with things that you might need during hot days. That would be things like air conditioning, as we just saw, water, and shelter. And then don't forget people that have substance or alcohol use disorders, because oftentimes they don't even realize the signs because of the intoxication or the effects of the substances they're using. And also utilize pharmacies, because there are some medicines, particularly psychiatric medicines, but there are some neurologic medicines as well, that will increase your core body temperature. So what you or me may feel heat exhaustion, let's say at 103 degrees, they may actually feel it at 99 degrees because their body temperature is already increased because of the side effects of those medicines. So I put this picture up. You can see on the right, this shows one of the hottest days in a populated area in the last couple of years. No means the hottest. It's been hotter in some cities this year. So this was Dubai, July 17, 2024. The heat index was 144 degrees Fahrenheit. So the other part of why that's important is humans are in extreme danger when the heat index gets to above 122 degrees. The other piece of this is air quality. So you also see the forecast for air quality every day, especially on hot days. Does anybody know what number the air quality index is when you start feeling health effects? Any guesses? So around 300 is the upper limit of what's healthy. Lahore, Pakistan, a few weeks ago, hit an air quality index of 700. So the next thing I want to talk about is urban planning. So cities and counties can increase green spaces, promote reflective surfaces, and redesign ventilation. So this means incentivizing building of green roofs, developing parks in an equitable way. And this is important because a lot of cities are building parks, but they're building it in certain parts of the city so everybody can't use it, especially those most vulnerable. So you have to consider in an equitable way so that everybody is able to access it and use it. And then also you might want to consider community gardens because you can use that for food, for community, as well as further heat reduction. Reflective surfaces, so for example on roofs. So you may see some roofs that are like white on the top. That is because it's reflective. That scientific term is called the albedo. You want to increase the reflectivity because it's going to reflect the heat back up into space and not cause more heat trapping, causing that heat island effect. You can also redesign ventilation, which promotes airflow, reducing heat trapping, and reduces the use of air conditioning. And why do we want to reduce the use of air conditioning? Yep, because it blows off heat, but how do you power the air conditioning? With the fossil fuels causing the heat, right? So you want to try to reduce the use of air conditioning. And there's excellent examples from cultures all over the world, going all the way back to ancient Greece. And this is a picture of one of them on the right. That happens to be in the Middle East. But the middle picture kind of shows what the schematic of this is. And so you get hot air that comes in. There's cold air at the bottom. It kind of pushes the hot air out. And so you get cooler air inside. So it can help a little bit with the ventilation as well as the heat trapping. And so then you need less air conditioning, which then reduces the use of greenhouse gas emissions and increased temperatures. Again, don't forget about prisons, jails, detention centers, and also schools, because there's a lot of schools, especially older built schools, that don't have adequate ventilation and air conditioning. And so you're having kids having to go to school in this extreme heat. They're not very conducive to learning, much less their health. Also require new housing or upgrades be heat resilient through weatherization, ventilation efficiency, shade, and roof design. So one of the things that you may have heard is about public cooling centers. And this seems to be a very popular topic because intuitively it makes sense. They've been offered as a solution, but they don't really work for places with long stretches of days with temperatures above 100 degrees, like Florida and Arizona. So I think Bob had mentioned in his initial talk about Chicago. So back in 1995, Chicago hit a heat index of 125 degrees for 5 days. 700 people died. They had cooling centers, but the problem was, and it's the same problem that exists now 30 years later, is that they didn't know about them or because they were too far away, especially for those with mobility, medical, financial, or transportation issues. Same thing happened this year in New York City and Washington, D.C. with the high heat days. Same is true in places like Japan and India. The Southeast has 1,400 cooling centers, but a 2023 study showed that only 36% of the population and less than 10% of vulnerable populations are within 15 minutes of a cooling center. So they're not really serving any purpose. However, cooling centers have been shown to reduce severe heat illness in the most vulnerable populations, but not so much in the general population. So maybe we can build these cooling centers or retrofit existing buildings to serve those populations, the vulnerable populations. Also remember the resource allocation, fans, water, medical supplies. Need to make sure those are there. Transportation logistics, like rideshare or public transport, could also be considered for those vulnerable populations. But the best approach, I think, is prevention. So that really comes from urban planning and heat-resilient built environments. So clinician training. It was mentioned earlier that we need specific education of physicians, nurses, pharmacists, and EMTs on heat illness, especially here in Florida. I'm not going to belabor that point, but as Dr. Fu mentioned, we do this for heart disease and breast cancer and colon cancer in terms of community efforts to raise awareness. Why don't we do it for heat illness? We should do it for that too. Health systems need to integrate climate hazards such as heat into existing disaster management plans and for all climate-related health hazards. So here's the example that's recent, Hurricane Helene in Milton. So just take, for example, the hurricane. It comes in, causes a power outage, so you lose AC during the heat wave, worsening air pollution because all the trucks, and then everybody has their petroleum-based generators, causing more air pollution. The water gets contaminated from flooding, and then you get soil erosion, resulting in an infectious disease outbreak. But wait, that actually happened with Milton. There was a dengue outbreak just a week or two ago because of that, because of all the standing water and all the mosquitoes. So this does happen even today. So disaster medicine training right now only requires 3 days of supplies on hand. That's what the curriculum says. So I ask you, is that sufficient? Do you think 3 days of supplies is going to work for us here in Florida? Think about the last few years of hurricanes. Probably not. Clinicians also need to advocate for implementation of climate resilient health systems. And I'll give you an example. So I just came back from the American Medical Association meeting in Orlando 2 days ago. One of the issues that we talked about was an effect of Hurricane Helene in Milton. So let me back up. Hurricane Maria, when it hit Puerto Rico, there was a national IV fluid shortage. And the reason was because of, like most things, we decide to put all our eggs into one basket and have one or two companies make all of our critical supplies. So almost all our IV fluid was being made by Baxter Corporation in Puerto Rico. That got destroyed. There was a national IV fluid shortage. Hospitals didn't have IV fluids. Elective surgeries had to be canceled nationwide. So they moved it to guess where? Asheville, North Carolina. And it happened this year. And then Milton came in, and the second biggest producer of IV fluids in this country is a factory in Daytona Beach, which also got hit by Milton. So currently, it's ongoing for the last few weeks, there is a national IV fluid shortage. So I cannot order IV fluids for patients unless it's an absolute emergency. And a lot of hospitals have canceled elective surgeries because there's not IV fluids. This is going all the way up to the president and HHS, but the government hasn't learned their lesson before. They're probably not going to learn their lesson this time about not putting all your eggs in one basket. As another aside, the global healthcare sector contributes 4.8% of global greenhouse gas emissions. In the US, the healthcare sector contributes 8.5% of all of our US global greenhouse gas emissions. So if you quantify that, just the US healthcare sector puts out more greenhouse gas emissions than everything out of the United Kingdom. That's how much greenhouse gas emissions we put out in our healthcare sector in the country just because we're so big and because we need to do everything all the time. So community outreach. Cities and counties can facilitate education on prevention at home, in the community, in the workplace, and for those working outdoors. Communities can also provide important granular data on vulnerable populations so that resources such as fans and water can be arranged. So again, the national resources, they don't get granular enough down to the neighborhood level. This is what communities can do. And I think volunteers can be used to check on at-risk individuals, particularly on high heat days. So we do the same thing, for example, Meals on Wheels, or people who are stuck at home, disabled people, people with psychiatric conditions. We can do it for the same thing for at-risk people for high heat days. So again, elderly, chronically ill, those with mobility issues, the unhoused, veterans, children, and then those with limited financial means. And then the big thing, I think, and if you recognize this as the Florida Senate, is policy and legislation. So I talked about building codes, about retrofitting for making it more efficient. In the workplace, what I would say is, and this happened in session this year, and I actually testified in front of the Senate on this, is they passed a preemption law, and it was signed by the governor, that said that if local governments want to mandate stronger heat standards for employers towards their workers, that is now illegal. It has to be by the state. And the state's requirements are much, much less stringent. So what I would say is we need to reverse that preemption law at the state level so that counties who know best, because what happens here in Sarasota County is different than what happens in Duval County, right? They have different climate. To allow counties and cities to mandate water breaks, access to water, and access to shaded areas with ventilation and cooling for outdoor workers and athletes. And that does result in significant results. OSHA and CDC regulations aren't strong enough. There's currently a comment period with OSHA until I think mid-December on those heat standards. So if you're interested, you can go onto the OSHA website and put a public comment about that. And the state of Florida regulations, as I said before, are inadequate. And David, you're gonna like this. So I just happened yesterday to find a paper that was published 2 weeks ago by former Senator Bill Frist, a cardiac surgeon, and Vanessa Carey, daughter of John Carey, and herself, an intensive care physician. And they summarized research that addresses heat protection for workers, but it's good for business. So they said 2.5% of worker productivity drops for each degree rise in temperature above 80 degrees Fahrenheit. And that costs the US $100 billion annually, and that'll double by 2030. And so when they looked at, if it's been done before, they looked at heat protection measures at a sugar plantation in Nicaragua. There was a 72% reduction in injuries, 94% decrease in hospitalizations, and 20% increase in productivity. But we could expect better results in the US because 62% of Americans who have employer-based health insurance have at least one chronic condition. But only 17% of America's CEOs have put any resources towards climate protection for their employees. For athletes, there's 2 interventions that have been most studied. Wet bulb globe temperature, which I mentioned before, is how hot the body feels in the sun. So school districts actually set these policies. So check with your local school district to see if they have a policy for their athletes that practice and play outside. And some universities are now starting to implement them. Heat illness needs to be integrated into disaster preparedness plans. And lastly, the city and the county can't put climate sustainability as a key factor in future planning and regulation. Or they need to put it so that we don't exacerbate the heat issue. So public transport, green spaces, tree cover, walkability, bikeability, and they can work with and advocate to state and federal lawmakers on regulation enforcement and assistance. So finally, I'm going to talk about research and development. So just briefly on R&D, mitigation of the cause of heat-related risks, that's what we got to do, fossil fuels. So everything I talked about is adaptation. None of that will work if we don't address the cause. That's why mitigation must be paramount for any climate health-related risk. We can't expect to keep mopping up the floor if we don't address the root cause and shut off the tap. And let me just be clear on this. Climate change is not an existential threat to the Earth. It is to us and other species, but not to the Earth. The Earth will be just fine. We will not. There are pilot programs on heat warning systems, action plans, and urban planning, community outreach, and policy programs. We need more of those. But having said that, there's already so much data, ideas, and pilot projects and policy proposals. We just gotta do something at this point. We've got to actually put that into action. So here are some of the government resources that I mentioned throughout my talk, and some of the references. And thank you.
We are under a lot of time pressure because we're going to talk about disease after the break. So we will do a lightning round question. You have 15 seconds to ask the question. Anyway, Dick Coey, 15 seconds.
My question is, for this white bulb indicator, is it on the TV in the morning? Where do we find it, and how do we interpret what's dangerous, what's not so great? How do we actually functionally use what you've identified?
Unfortunately, it's not used on a regular basis because it's difficult to measure, because again, it's including two more variables, the winds as well as the intensity of the light. So it's not used regularly. It's used in research, and it's used in some universities for some of their athletes, but that's because they have research labs. What I would say is, if you see that the heat index is 120, you know the wet bulb globe temperature here in Florida is a lot higher because we get much higher intensity of sunlight than, let's say, Massachusetts.
So we just judgmentally
No,
judge.
15 seconds, you're done. 12 seconds.
Wait,
Wait, the government doesn't have.
let us try to do the questions that we can get a mic.
Repeat the question.
Florida, we can't say that. How about if the medical people rise up and say this is a problem? How about if we go to our professions and our professions say this is what's.
So the question is, because the government doesn't allow us to use the word climate change, and yes, that was signed into law to remove climate change from every policy document and legal and law in the state of Florida this year, the question is, how about the health professionals? We're doing it. So we have Florida Clinicians for Climate Action. It's actually the Florida chapter of the Medical Society Consortium for Climate and Health. Almost every medical society in the country is a member of that. As I mentioned, I just came back from the AMA meeting. We actually, on the last day, just created an informal climate caucus, and we already have about 100 physicians. So that is being done, as well as in education. And for meetings like COP, we're going over, and it's the worldwide health community. There's probably about maybe 1,000 of us that are there out of about 80,000 delegates. But I will say that the last several years, including already this year, and it's day 4, there are more oil and gas lobbyists at the COP meetings than any single country or civil society delegation.
Ladies and gentlemen, Dr. Fu, we wish you well. We want you to get better, and you come back next year. We are going to cut off the Q&A because we are into next session's time, and we thank for this wonderful presentation that we just saw. The 15-minute break is 12 minutes, and then Terry will start the second session. 12 minutes.
And Dr. Fu, if you wanted to say hello real quick, you can do that. There's Dr.
Okay,
Fu.
all right, hi. I wish I could be there. It looks like you're having a great time. Just a couple things I wanted to add was that Bob Bunting said stuff about the heat index, and everything I said corroborated what he had said. And then finally, as for the question about what Dr. Benzel said about which country would be the experts, I thought the answer was Pakistan, because I've been seeing a lot of interesting data coming out of Karachi. So I thought Pakistan would be ahead of the curve as well.
He's shaking his head in agreement. Thank you, and everybody says get well, Dr. Fu. Thank you.
Okay, thank you. Bye.